Hi, my name is Leanna.
And I'm Ada, and today we will be talking about fetal development.
So we're not necessarily going to be talking about the initial fertilization process, but we're going to be talking about the fetus's development from month 1 to month 9. So we hope you enjoy.
During the first month of pregnancy, the fertilized egg is beginning to grow. A watertight sac forms around the embryo, which then gradually fills with fluid. This is called the amniotic sac, and it helps cushion the growing embryo. During the first month, the placenta also begins to develop. For those of you who do not know what the placenta is, it is a round, flat organ that transfers nutrients from the mother to the embryo. An example of one of these nutrients would be oxygen, since the embryo is unable to breathe on its own. The placenta additionally allows for the transfer of waste. The placenta is attached to the wall of the mother's uterus, and the embryo's umbilical cord arises from it. It looks similar to this. A primitive face will take form with large dark circles for eyes. At this time, the mouth, lower jaw, and throat are developing. Blood cells are taking shape and circulation will begin. The tiny heart tube will beat 65 times a minute by the end of the 4th week. By the end of the first month, the embryo is about 1/4 of an inch long, smaller than a grain of rice. During this time, there is a 50 to 75% chance of miscarriage. Often, women won't even know they were pregnant if they miscarried during this time.
During the second month of fetal development, the embryo's facial features continue to develop. Each ear begins as a little fold of skin at the side of the head. Tiny buds that eventually grow into arms and legs are forming. Fingers, toes, and eyes are also forming. The embryo will start moving, however, the mother won't be able to feel these movements until later in the pregnancy. The neural tube, which is the brain, spinal cord, and other neural tissue of the central nervous system, is well formed. The digestive tract and sensory organs begin to develop. Bone starts to replace cartilage at this time as well. The head of the embryo is large in proportion to the rest of the embryo's body. By the end of the second month, the embryo is about 1 inch long and weighs about 1/30th of an ounce. This is equivalent to the size of a grape. At about 6 weeks, the embryo heartbeat can usually be detected. After the 8th week, the embryo is called a fetus. Pregnancy brain may occur, as well as many other symptoms. Pregnancy brain is a feeling of forgetfulness and mind fogginess that some people experience during pregnancy. Other symptoms include morning sickness, weight gain, nausea, and fatigue. It's important to note at this point in pregnancy, the miscarriage rate is around 8 to 15% at the beginning of the month and drops to nearly 2% after 8 weeks. The mother will also receive a due date at this time, although very few women deliver exactly on their due date.
During the 3rd month of fetal development, the fetus's arms, hands, fingers, feet, and toes are fully formed. The fetus can open and close its mouth and fists. Fingernails and toenails are beginning to develop, and the external ears are formed. The beginning of the teeth are forming. The head of the fetus is still larger than the rest of its body. The head is nearly 1/2 of its total size. The fetus's reproductive organs also begin to develop, but the baby's gender is difficult to distinguish on an ultrasound this early in development. By the end of the 3rd month, the fetus is fully formed. All the organs and extremities are present and will continue to mature in order to become functional. The circulatory and urinary systems are working, and the liver begins to produce bile. At the end of the 3rd month, the fetus is about 4 inches long and weighs about 1 ounce, which is about the size of a plum. Since the fetus's most critical development has taken place, the chance of miscarriage drops considerably after these 3 months. It is expected for the mother to regain some strength, energy, and appetite. Weight gain shouldn't be very apparent at this stage, and often women don't even begin to look pregnant.
Month 4 of fetal development is also the beginning of the 2nd trimester. The fetus's heartbeat may now be audible through an instrument called a Doppler. Doppler ultrasonography is a medical technique that allows for imaging of the movement of tissues and body fluids. At this point, the fetus's fingers and toes are well defined. Eyelids, eyebrows, eyelashes, nails, and hair are formed. Teeth and bones become denser. The fetus's head is becoming more erect and the heart is pumping out 25 quarts of blood a day. That's a little more than 6 gallons. The fetus can even suck its thumb, yawn, stretch, and make faces. These are reflexes that the fetus is developing in order to survive outside of the womb. Additionally, the nervous system is starting to function. The reproductive organs and genitalia are now fully developed, and a doctor can see on ultrasound if the mother is having a boy or a girl. This trimester is the most comfortable trimester as far as being pregnant goes. Many of the early nausea and fatigue symptoms are gone, and it's not as uncomfortable as the third trimester. Moderate exercise is strongly encouraged during this trimester. By the end of the 4th month, your baby is about 6 inches long and weighs about 4 ounces, which is about the size of an avocado.
During month 5, the mother may begin to feel the fetus move since he or she is developing muscles and exercising them. This first movement is called quickening. The fetus is now sleeping in regular intervals. The fetus can hear the mother's heartbeat and other sounds outside the body. Women often notice that the fetus reacts to sudden noises like a door slamming or an object falling. Fine hair, called lanugo, covers the fetus's body, as does vernix, which is a creamy coating layer that protects the fetus's delicate skin from the months of submersion in water. This coating is shed just before birth. Hair begins to grow on the fetus's head. The fetus's shoulders, back, and temples are covered by a soft, fine hair called lanugo. This hair protects the fetuses and usually shed at the baby's first week of life. The mother may be beginning to feel the stress of the weight added that she is carrying, which can cause bowel problems, leg cramps, fatigue, and an increased heart rate. Calcium will help with the leg cramps, and drinking lots of water can help relieve constipation, and it is important that she receives enough rest. By the end of the 5th month, the fetus is about 10 inches long and weighs anywhere from between half a pound and a full pound. This is about the size of a banana.
The fetus's skin is reddish in color, wrinkled, and the veins are visible through the baby's translucent skin. The fetus's finger and toe prints are visible, and the eyelids begin to part and the eyes open for short periods of time. The lungs are continuing to develop, and the fetus will start to practice breathing. The fetus may even get the hiccups, and the mother may feel them as well. During this stage of development, the fetus responds to sounds by moving or increasing the pulse. By the end of the 6th month, the fetus is about 12 inches long and weighs about 2 pounds. This is about as long as an ear of corn. If born prematurely, the baby may survive after the 23rd week with intensive care. As the mother's belly begins to bulge and the skin is stretched, she may begin to experience tight, itchy skin. Daily application of a moisturizing lotion can help relieve some of the discomfort. Her extremities may be increasingly swollen, especially by the end of the day. If there is dramatic swelling over a short period of time, call your doctor.
Month 7 is the beginning of the 3rd trimester. The fetus will continue to mature and develop and reserve body fat. The fetus's hearing is fully developed. The fetus will change positions frequently and respond to stimuli, including sounds, pain, and light. The fetus will often turn towards a light source around this time. Additionally, the amniotic fluid begins to diminish. And now the fetus has taste buds and is putting on more layers of fat in anticipation of life outside the womb. As the fetus gets larger, it is quickly running out of room, and the mother may notice a decrease in the intensity of kicks, but also be able to notice the shape of an elbow or heel through the belly. At the end of the 7th month, the fetus is about 14 inches long and weighs anywhere from 2 to 4 pounds. This is about the size of a large squash. The mother may be experiencing Braxton Hicks at this time, which tend to feel like contractions but aren't true contractions. If born prematurely, the baby would be likely to survive after the 7th month.
The fetus is getting ready for birth and is probably in the head down position. The fetus is approximately 17 inches long and weighs about 5 pounds, which is about the size of a pineapple. Brain growth is dramatic this month, and most of the organs are ready to go, but the lungs will still need a few more weeks of development. The mother may be feeling very tired and uncomfortable at this stage. The fetus is pressing up against a spinal column, which can give the mother a terrible backache and make it difficult to get comfortable. Braxton Hicks may also be increasing in strength and frequency at this time.
During month 9, the fetus continues to grow and mature. The lungs are nearly fully developed. The fetus's reflexes are coordinated so he or she can blink, close the eyes, turn the head, grasp firmly, and respond to sounds, light, and touch. The fetus is 20 inches long and weighs about 7 pounds, although he or she is still gaining an ounce a day. The fetus is preparing for birth this month by shedding most of the lanugo and vernix that has been covering and protecting his or her skin. Your fetus can survive outside the body now, even if he or she is born a little early. The lungs are still secreting suffocant, the substance that will keep the lungs from sticking to each other, and inflate fully after he or she takes that first breath of air. You may notice that the fetus moves less due to the tight space. The fetus position changes to prepare itself for labor and delivery. The baby drops down into the mother's pelvis, usually head first towards the birth canal. Scientists still don't know precisely what triggers labor to start, which could happen any time now during this month. Most babies are born within 2 weeks before or 2 weeks after their due date. After this month, the fetus is born and enters the world as a baby.